when I came to this hospital, I was so excited to learn about the different programs and see this beautiful gym that's all free.
Good afternoon, everybody, and welcome back into another episode of For Your Health, the podcast sponsored by Roane General Hospital, attacking all things the Prescription for Your Health program. I'm Andrew Miller, your host. As usual, I've got a special guest with us who has not been here for very long. It's Dr. David Francke, the cardiologist here at Roane General Hospital, who specializes in the advanced treatment of cardiovascular diseases and other heart conditions. Now, for the layperson, I don't know a lot about that, so I'm going to ask him to tell us all there is to know about the heart. It's not true. I'm not going to ask you all there is to know.
Sure, we'll wrap that up in this podcast. There we go.
We've got about 17 hours for this podcast in that case. Dr. Francke, number one, thank you for joining us. We do appreciate you giving us of your time. You're very new here to Roane General Hospital. As I was talking before we came on air, you're just now into your second week or just finishing up your second week here?
Yes.
That's very nice. It's nice to have you here. I've already seen your face on some advertisements in our local paper, so you're going to get famous very, very quickly.
Yeah, they put me out there a little bit, and it's really good to be here.
Yeah. Well, Dr. Francke, let's talk about you first. Let's talk about your history. What got you into the medicine field, and then what specifically about cardiology piqued your interest. Where did you go for it, and how did you end up here in Roane General?
Sure, absolutely. Yeah, so I'm a West Virginia guy. I've been here all my life. Grew up in Charleston. And I really, when I started trying to decide what I wanted to do for a career, I was about 18 years old, and I thought I really like the healing process. And I didn't know what I wanted to do with that. I kind of thought maybe I'd want to go into medicine and be a physician, but specifically, I didn't know what I wanted to do. So when I went to college, I started taking pre-medicine classes, got a little bit more interested in it, especially in some of the classes that related more to medicine and the human body and physiology and that sort of thing. Decided I wanted to be a doctor. So applied to medical school, and I ended up going to Marshall for medical school, and I was in Huntington for quite a while. I did my medical school at Marshall, and then I did my internal medicine residency program at Marshall, and an internal medicine residency program is essentially a generalized training program for adult medicine, and you can pick many different subspecialties of internal medicine, including cardiology, which I ultimately decided to do, pulmonology, gastroenterology. There are several different things, several different tracks you can take from there. And it wasn't until right before I had to apply for a subspecialty that I decided I wanted to do cardiology. Yeah. And part of the reason for that is that it's kind of a perfect field for somebody that's interested in internal medicine and interested in multiple different areas of medicine, because there are many different things that a cardiologist does. So you see patients in the outpatient setting, you see them in the inpatient setting. There's a critical care aspect for cardiologists that practice in hospitals with intensive care units. There's a lot of intensive care. There's also kind of a radiology sort of component to it. Cardiologists read different types of scans, echocardiograms, which are ultrasounds of the heart. They're CAT scans of the heart that cardiologists read as well. And then there's a procedural aspect that I enjoyed as well, with heart catheterizations, which I did for many years before I came to Roane General at CAMC. where I practiced before. So I kind of looked at it as an opportunity to not leave a lot of the things that I enjoyed during my internal medicine training behind. So that's how I chose cardiology, and it's been a really rewarding pathway. It was a long pathway. After my internal medicine training, I did a fellowship in cardiology also at Marshall, and then a fellowship in interventional cardiology, which is kind of like stent placement with heart catheterizations. And then I ended up coming back to my hometown, Charleston, to practice at CAMC. The lifestyle of an interventional cardiologist is pretty busy. And so I was kind of missing my family, my wife and my kids a little bit. And there were a couple different hospitals that I always thought, if the job opened up, I'm at least going to reach out and call about it. And I talked to Doug Bentz, the CEO, about the opportunity here at Roane General, and it just sounded amazing. So that's how I wound up at Roane General, and I have not been disappointed. As a matter of fact, I've been to Spencer only one other time in my life. It was for a football game in 1999. Actually, two. I played basketball here as well, but it had been a long, long time. I'd never seen the hospital, and when I showed up to meet with Doug the first time I came up here, I was just blown away. It's one of the most beautiful hospitals I've ever been to in my life, one of the cleanest hospitals I've ever been in my life, and it's just been wonderful. And then the Health and Wellness Center.
Yeah.
I couldn't believe it. I haven't seen anything like it in the hospital. It's really nice.
I don't know where that came from when it came to Doug and his staff and the board of directors, how they came about wanting to expand. I know that it's been, ever since Doug has been here, it's been a dream and a want to bring in more providers in different areas, specialization providers in a small rural area that's hard to do sometimes.
Sure.
And so that, coupled with this capital expansion program over the last 10, 15 years, has been nothing short of remarkable for this small area. And, we do thank Doug and his crew and all the people that are involved in that. It has made this a really nice destination to be it for preventative medicine, when we're talking about this prescription for your health, or reactive medication, whatever it may be, for all of the services that now Roane General Hospital provides. And as you said, if you wanted to slow down just a little bit, I guess Spencer and Roane General is a probably good place for you to fit in.
Absolutely. Absolutely. Yeah. So I've been seeing a lot more of my family just in the past couple weeks that I've been here, and it's been wonderful.
Now, are you still commuting from the Charleston area?
Yeah, I'm making the drive. That's the other thing. So I think we've only had like 2 nice days.
You really came at the worst possible time.
I know it, but it hadn't been too bad.
I don't know when this podcast is going to come out, but people will know we're talking about the area of January and February in Roane County right now.
Yeah.
It has been rough.
Yeah, it's been rough.
It's either flooding or ice on the roads or snow. So let's talk a little bit about cardiology and how we're going to connect this specialty to what we're talking about throughout these podcasts, which is overall health and wellness, and as it relates to your overall wellness. Well, the heart is a muscle, and it's a big muscle,
Indeed.
and it's quite an important muscle to have.
We got to take care of it. Absolutely.
So let's get into right away. You're a specialist. So what would be some of your general how do I put this, suggestions, if you will, for having a healthy heart and whatever age you may be?
Absolutely. And so there are many ways that as a physician we treat the heart and we prevent heart disease. And when we find heart disease, we help prevent that from becoming more significant. And of course, medicines and procedures are a big part of that. But there are also multiple risk factors that are well known to contribute to heart disease, including high blood pressure, diabetes, high cholesterol, tobacco use, sedentary lifestyle, obesity. All of these things are really, really important to manage. And a lot of those risk factors are out of the control of the physician.
Yeah.
And so when I came to this hospital, I was so excited to learn about the different programs and see this beautiful gym that's all free.
Yeah.
I mean, it having this facility with this free exercise program and the excellent staff and resources that we have are things that you just don't find in large communities, much less smaller communities. And it's wonderful for a cardiologist to have those resources available to talk to patients about, to discuss with patients, to help improve with some of these lifestyle-based risk factors.
And I'm sure you've seen the numbers in Roane County, the numbers, and when you spoke of the risk factors, you look at the numbers for Roane County, and those things are spiked all over the board. And,
right.
And in West Virginia is one of the toughest in the nation. Roane County is one of the toughest in the state. So there's an aggressive program, obviously, that's being undertaken here at Roane General.
Absolutely, and I mean, there's no better community for a program like the Prescription for Your Health program, like the resources we have here, than for a place like Spencer and Roane County. So that's excellent.
So that's on the reactive side of things. If someone already has many risk factors, or if they're already dealing with some issues with their heart. But there's also, again, this program is not only designed for that. This program is designed to be proactive and preventative medication. So if somebody, let's say somebody comes into you, just ask some questions about, what are the best ways? Maybe it's one of your patients who has family members who don't have the issues yet. What are some of the suggestions you have for them to keep that healthy heart, develop that healthy heart?
Sure.
You can do many things, I assume.
Oh, absolutely. And I mean, there are studies that back up the importance of a heart healthy lifestyle. And one of the, when patients ask me questions of that nature, one of the things that I mention is that the American Heart Association recommends that all adults, whether they're completely healthy, whether they have cardiovascular disease, all adults across the board can benefit from regular, moderate aerobic exercise, okay? And so I recommend to patients, whether they have cardiovascular disease or not, that they try to get in about 150 minutes a week of good, dedicated aerobic exercise. And that can be any type of exercise that the patient wants to participate in, so long as it gets their heart and lungs going to the point where they'd have difficulty carrying on a conversation with somebody.
And I wonder, that's probably patient-specific, I would assume, when it comes to their level of previous fitness or lack thereof. It's kind of self-sustaining at your pace. Whatever gets you to that level is that level for you.
Absolutely.
Okay.
So, and that's, the recommendation that's given that I just mentioned is it's really nice because a lot of patients will say, well, when I exercise, my heart rate gets to this, or I don't achieve this with my heart rate. They're looking for more objective markers on how they should be exercising, but it's actually really simple. You just listen to your body. Yeah. And if you're walking on a treadmill and not really, you're feeling pretty comfortable, able to carry on a conversation with somebody, then the recommendation is to step it up a little bit. And as long as patients hit that 150 minutes a week, and a lot of patients try to do 30 minutes 5 days a week. A lot of patients try to do 50 minutes 3 days a week. Yeah. As long as they're hitting those markers, there's tremendous cardiovascular benefit.
And we talked with Dr. Musa Dejani on a podcast. He was talking about these new age micro workouts, for people who are on the go, having a long day, they can't get free a lot. He's talking about doing these 10-minute little things while you're multitasking.
Sure.
Whether you're on the phone with somebody, you take 10 minutes and you walk around wherever it may be within the building here. So there's ways that you can get that number, that 150 minutes a week. It doesn't have to necessarily be all at one time.
Right.
As
It
long
does
as you're
not.
getting those cumulative effects each week, that will help you if you do have some of these chronic issues. And even if you don't, as you said, you still recommend people to keep that heart healthy and pumping. Let's say somebody does have let's say they have heart disease in some form or fashion, or they
Sure.
let's say they have a comorbidity, that's diabetes as well. What are some considerations for these people when they take off on, let's say, this prescription for your health program? What are some of the things you want them to be focusing on? What are some of the things they need to be thinking about and I guess cautious of with regards to their own bodies?
Sure. So if somebody has a known diagnosis of heart disease, okay, let's say they have some plaque in their heart arteries, okay, these exercise goals become even more important. Dietary modifications become more important, and we have a great system with prescription for your health and some other dietary counseling options that can really benefit patients. But we really want to make sure that those patients are not only getting in the exercise goals and getting in the counseling from a nutrition standpoint, also following up with a cardiologist, following up with their primary care physician, and making sure that those patients are having a little bit closer monitoring. We want to keep a close eye on their cholesterol levels, make sure they're on proper medications that keep their cholesterol levels at goal, to prevent plaque buildup going forward, to prevent heart attack and stroke. And then also, of course, blood pressure monitoring. And the prescription for your health program actually does a little bit of that too, which is fantastic.
It's again, I keep saying this on all these podcasts, it's all encompassing when it comes to health and wellness, whether it be reactionary if somebody's already got a condition or if it's preventative without that. And again, I think about cardiac rehab, which is right there beside the fitness center for people who may have had some serious heart issues to recover from that. As a cardiologist, on top of obviously you want people to be active, and you said the 150 minutes a week at least if you can get that. So let's say somebody has some heart condition, has some heart problems. On your side of things, how can you treat some of those things on top of the exercise that they're going to be getting? What are some of the conditions that you have to treat? Are there any surgeries? You mentioned intervention, stents and things like that. What are some of the things you do with the big muscle inside there?
Right, absolutely. So if patients develop significant blockages that are causing chest discomfort, typically what we do is we start with a workup to determine the significance of the plaque that may be in their heart, which would involve a stress test or maybe a special kind of CAT scan of the chest that's specifically of the heart, that's specifically designed to look at the heart arteries, see if there is a significant amount of plaque that may be putting a patient in harm's way. And then we refer patients. We don't do heart catheterizations here at this hospital, but we refer patients for a procedure called a heart catheterization, which is essentially a procedure where a cardiologist, it's a minimally invasive procedure, usually outpatient, where a cardiologist will take a long, tiny tube called a catheter up through a patient's wrist where they can feel their pulse, or up through their groin to their heart arteries, inject some contrast dye through their arteries while watching on a special kind of x-ray machine, see if there are any significant narrowings or blockages that need to be addressed with either a stent, which is like a metal tube that opens up the blockage, or with open heart surgery, with a bypass surgery, if it's really significant disease.
Boy, it's amazing the advances in technology. You said it's an outpatient thing?
Yeah, usually it's day in, day out.
Wow.
Yeah.
That's impressive. I wonder how long has that been in effect? I mean, it seems like that's been something that's been taking place for a while
heart
now.
catheterizations have been going on for decades. The stenting procedure since about the 90s.
Sheesh.
So, yeah.
Outpatient. That's crazy to me.
Yeah.
It's pretty cool though. So you get to do those things.
I did when I was at
you did?
CAMC.
Okay.
I've stepped away from that Don't do that anymore. But those procedures are readily available to patients that need them. And then kind of on the follow-up side of that, if patient has a stent placed or if they've had a heart attack, you mentioned our cardiac rehab program that's right down here with our prescription for your health program in the gym just down the hall. Excellent program for patients that have had a significant cardiovascular event. And it's excellent not only to hit those exercise marks that we talked about, but one of the most frequent questions that I get when somebody has had a major setback like a heart attack is, well, where do I go from here? What can I do? This happened when I was shoveling snow. I'm afraid to exert myself. I'm afraid to exercise. And the cardiac rehab program is awesome at getting those patients back up on their feet and getting them moving around again, getting their heart rates up, giving them confidence that they can go out and be more active.
Because that's a scary thing to have happen.
It is. But oftentimes, the patients that have events like this oftentimes are back up on their feet doing what they were doing before the event, like nothing happened.
We were talking before we actually came on the air about some of these conditions that you've dealt with or seen over your time, both being at Charleston and now just in 2 weeks here.
Right.
I was looking at the list of things, and hyperlipidemia was one thing, but you didn't want to just focus on that. I wanted to give you the chance to talk about some of these conditions that you've seen and some ways to, again, prevent or treat.
Sure.
Either way.
Yeah, absolutely. So all of these risk factors that I mentioned before, the hyperlipidemia, which is increased cholesterol, high blood pressure, smoking, sedentary lifestyle, all of these things. And then unfortunately, there are some things that we can't control, like genetics, family history, but all of these things can contribute to heart disease. One of the more common ways that we see that is through atherosclerosis or plaque buildup in the heart arteries. And so the way a blockage develops, you've got cholesterol in your bloodstream. And if a patient has high blood pressure, diabetes, this can lead to inflammation within the blood vessel itself, within the heart arteries. And this cholesterol plaque can be pushed into the wall of the artery, and over time it becomes more and more narrow, which ultimately can limit oxygen to the heart muscle itself because it's delivered by blood. So if you have a narrowing or a blockage that's significant enough in the heart arteries, that's gonna limit oxygen delivery to the heart muscle, which can cause chest discomfort. Oftentimes patients start to notice that when they get up and start being active. That's the first time that they notice chest discomfort, because once the heart really starts squeezing hard and squeezing fast, the oxygen demand of the heart muscle increases. And if there's a blockage, if there's plaque that's limiting blood flow and oxygen delivery, that hurts.
If somebody doesn't know the signs and symptoms of that happening, chest pain, maybe a lightheadedness, what other?
Sure. So typically, the typical symptoms of heart pain, or as we call it, angina, some call it angina, are chest pain, chest pressure, chest tightness. That discomfort can move to the arms and up into the jaw, and then also shortness of breath, unusual shortness of breath. So if patients are experiencing symptoms of that nature, we highly recommend that they get checked out so that we can do a little bit of a workup and find out exactly what's going on and what we need to do to fix it, to take care of it.
And as you mentioned, this is the first opportunity that you've seen that you guys, and again, this prescription for your health program came from Dr. Scott Duffy's mind, where he was prescribing his patients go to the gym and start exercising. So this is kind of a neat opportunity for you. You come to a new job and you get to kind of dive right in here with this program as well. That's got to, as you said, this is not something that happens in even big cities. This is kind of a pilot program that's taking place here, and you guys get to be involved in it basically on the ground level. It's been in effect for, I believe, 4 years now, but it's been 10 years, I think, of planning, looking at the data, getting all the pieces where they needed to go. And then we need a cardiologist involved in this too. So here
Sure.
you are, you're ready to go help out with this. That's very fun.
Absolutely. Yes. Yeah. I'm a member myself. I enrolled in the first week that I was here last week. So I love being a part of it, and both as a member and then also as somebody that gets to recommend to patients this wonderful program.
Well, if you had one piece of advice to give your patients, what would it be? But be it regarding heart health or anything else, what would that piece of advice be to people who may be nervous, be scared of the unknown, have never been to the gym, don't know what it means? There's a lot of fear involved in that.
Sure, absolutely. And easier said than done, but the first step is to go. And I promise that once they get there, they get to know the people there, they start exercising, they start moving around, they're going to feel better. The benefits to exercise go far beyond the heart, and it's excellent for mental health, for mental wellness, anxiety, depression. Life's better when you're exercising, for sure. And that's what I tell patients. And then also, I don't like to do this so much, but there are consequences to a sedentary lifestyle.
Yeah.
So, and there's only so much that as a physician you can do. There are a lot of patients that, as I'm seeing them and talking to them, they're on great medicines for heart disease, still not feeling so great. And I think to myself, what you really need to do is get up and get moving and get exercising. And that's the next conversation we have. And patients that are able to do that feel so much better, and they're so much healthier.
Yeah. Patients who are on medication, have you ever seen somebody dig into the exercise and the healthy lifestyle and ever get to the point where they don't need those medications, or are there some medications that are just going to be a requirement?
Right. So for patients that have a diagnosis of coronary artery disease, patients that have plaque in their heart arteries, they're always going to be on aspirin. They're always going to be on a cholesterol medicine. The blood pressure medications, however, that's different. So I frequently see patients that begin exercising, that begin losing weight. They come to the office and say, I've been really dizzy and my blood pressure's been really low. And I say, well, congratulations, you don't need your blood pressure medicines anymore. And we stop them, and they feel better. So yeah, it's not uncommon at all. There's patients that exercise get a real and significant reduction in their blood pressure and in their cholesterol levels.
So it's just about walking through the door.
That's it.
First step is walking through the door. Dr. Francke, appreciate your time with us. And again, welcome. I guess everybody's still welcoming you since you're just a couple weeks in.
Yeah, and everybody's been so great. I feel very welcome here. It's been wonderful.
Well, hopefully we can get this podcast out quickly so more people can see and hear about what you do here for Roane General Hospital. How can people contact you if they need to make an appointment to see you?
So talk to their primary care providers is one way. Also, if they call the hospital and ask for the cardiology offices, they can make appointment that way as well.
Main number, I believe, 4444 still.
I'm new here.
I can never remember.
I don't know.
There's 500 different ones. I think it's 4444 still.
Yeah.
They made it easy for people like me to remember.
Very good.
Dr. Francke, welcome to Roane General Hospital.
Thank you
we
so
appreciate
much.
your time, and I look forward to seeing and hearing from you more in this community as you continue this wonderful job as our cardiologist.
All right. Thanks, Andrew. I look forward to it.
That is Dr. David Francke, cardiologist here at Roane General Hospital. Folks, we appreciate you joining us. Make sure to follow us, subscribe to our channel, and continue to enjoy these Roane General Hospital For Your Health podcasts.